Okay, so when you think about what makes a hospital great, your mind probably jumps to the advanced medical tech or the amazing doctors and nurses, right? But what about the walls themselves? Today, we're going to look at how that simple hospital wall is transforming from just a divider into a really high-performance, strategic tool for patient care. And believe me, this isn't just about picking a nice paint color. We're talking about something that impacts patient outcomes, staff efficiency, and yeah, the bottom line.
I mean, it seems pretty straightforward, doesn't it? It's a wall. How hard can it be? But if you talk to any facilities manager or healthcare designer, they'll tell you it's a massive, massive challenge. It's this complex balancing act where the stakes are incredibly high for patients, for staff, and for the budget. So let's dig into why it's so tricky and how a new way of thinking is really changing the game.
All right, so here's our game plan. First, we'll dive into what makes this surface so high stakes to begin with. Then, we'll look at the common problems with traditional walls. After that, we'll introduce a modern solution and break down all the operational wins, how it impacts people, and finally, why it represents a much smarter life cycle.
So, what does a hospital wall actually have to do? Well, the answer is a whole lot more than just looking clean and holding up the ceiling. It's an active player in the entire healing environment. Just think about this job description for a second. We're asking one single surface to communicate vital information, to create a calm atmosphere for anxious people, and act as a tour guide through what can be a really confusing building. But at the exact same time, it has to be tough enough to handle constant, harsh cleaning and be flexible enough for when services change. Oh, and it needs to be installed with basically zero disruption. That is a huge, huge list of demands. So, with that intense job description in mind, how do the usual options, paint, vinyl wall coverings, how do they actually hold up? Well, this is where the trouble really begins. You see, there's this fundamental clash. Healthcare absolutely requires hygienic, seamless surfaces. But traditional vinyl, it peels right at the seams, creating the perfect little traps for dirt and germs. Hospitals can't afford downtime, but the usual installations are disruptive and smelly. They need durability, but the edges of vinyl just get torn to shreds by medical carts and gurneys. And updates? Forget about it. It's a messy, time-sucking removal process, not to mention all the supply chain headaches. For facilities teams, it's just a constant losing battle. So if the old way is broken, what's the fix? How do we bridge this gap? Well, the answer is in a much more modern approach: direct-to-wall printing. So what exactly is this? Basically, picture a giant, incredibly precise printer that, instead of printing on paper, prints a high-definition, durable image right onto the wall itself. And, I mean, pretty much any wall. Drywall, concrete, you name it. The ink is cured instantly with UV light, making it super resilient. And because there's no vinyl, no film, no sticky adhesives, the graphic literally becomes a part of the wall.
The on-site process is really slick and precise. Technicians come in and digitally align the artwork perfectly with things like doorways and outlets. Then, the pretty compact printer just gets to work, moving along the wall. After that, a durable, cleanable top coat goes on, and the space is ready to be used almost immediately. No lingering smells, no major disruption, no mess.
Now, this process delivers some major, major advantages from an operational standpoint. Let's talk about the big three here: speed, durability, and predictability. First up, speed. And honestly, this is an absolute game changer. A typical installation for a whole zone can be done in under 5 hours. Think about that. That's fast enough to slot in between clinical shifts. For a busy 24/7 hospital where you just can't shut things down, that is a massive, massive win. And for the facilities teams, the people who have to live with these walls every day, the benefits are huge. Right off the bat, you get rid of seams, which are always the #1 point of failure. The surface itself is built to handle hospital-grade cleaning. And maybe the best part of all, when it's time for a refresh, you just prime and paint right over it. That's it. No more scraping off old, gunky adhesive. But look, the benefits go way beyond just the operational side of things. This technology can create a profoundly better experience for the people who matter most: the patients, their families, and the staff. This quote really just nails it, doesn't it? By printing things like calming, natural landscapes directly onto the walls, you can take a space that's inherently stressful, like a waiting room or a pre-op area, and make it feel more restorative and healing. It's evidence-based design, finally made practical and durable.
And the applications are just so versatile. You can do soothing, low contrast patterns for behavioral health units, or fun, storytelling murals for the pediatric wards, or, and this is a huge one, you can integrate wayfinding directly into the architecture. Imagine color-coded paths on the walls that guide you exactly where you need to go. All that stress and confusion for visitors, gone. Okay, so this brings us to the final piece of the puzzle, the long-term view. Because a truly expert solution has to be smart about cost, and it has to be smart about sustainability over the entire life of the building. Anyone who manages capital projects knows this inside and out. The initial price tag, that's just a tiny part of the story. What really matters is the total cost of ownership. You have to factor in everything: the install, the maintenance, how often it needs to be replaced, and what it costs to get rid of it down the line. And when you look at it that way, the picture becomes crystal clear. Over a 10-year period, the cost of traditional vinyl just keeps adding up with all the repairs and the expensive, messy removal. With direct-to-wall printing, you get a faster install, it lasts longer, and updates are as simple as painting. The result? A significantly lower total cost over time. And on top of all that, it's a greener choice. You're completely eliminating PVC films and all that adhesive waste. The on-site process means way less shipping, packaging, and creating. And because the walls last longer and you can just paint over them, you're sending far, far less material to the landfill. It's a win for your budget and a win for the environment.
So this is the question I want to leave you with. In a modern healthcare facility, every single element, every surface, should be actively working to support better outcomes. So it's time to ask yourself, are your walls contributing to that mission? Are they elevating patient care, improving staff efficiency, and telling your community's story? Or are they just covering space?